Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we are going to talk about a very important case of fetal hydrops, right? So, meaning thereby that whenever there are two non-consecutive areas of the fetus, and when they do have a fluid accumulation, so probably it can classify as a fetal hydrops. So, meaning thereby that the subcutaneous edema and the pleural effusion, pericardial effusion, ascites. So this makes a part for the hydrops. On the other hand, ascites and the right pleural effusion, it has been regarded as the part of one continuum only. Okay. So whenever we see a fetal hydrop, so probably there are a lot of things that probably we talk about it and all those stuff. So there are a lot of differential diagnosis that goes into our heads, and therefore we try to look around what exactly that we're dealing up with. So this could be skeletal dysplasias, it could be sort of an inborn error of metabolism. So 7 to 8 varieties of an enzyme related disorders. We can have an infection for which we try to look around for the PSV, MCA. Aneuploidy is also one of the greatest markers, and Down syndrome or the aneuploidy markers could be one of the sort of a very common phenomenon leading to this fetal hydrops thing. Right. So let us first see these slides and these videos, and then probably we'll talk about what exactly was the clinching diagnosis and how do we reach to a diagnosis and all this. So look closely. This is the heart which we are seeing at 20 weeks. Okay. So in cardiomegaly, right ventricle is dilated, huge amount of holosystolic TR, pericardial effusion hugely. So which is anything above the atrioventricular groove, it is abnormal. Then we see the pleural, and then you see the ascites, a huge amount of an ascites available, and then this is the liver, and then the floating ribs, and then the bladder. So this is an hydrops. Now we put the baby into sagittal, try to look around for the mid phase facial features to the baby. Nasal bone doesn't looks that great, and the facial profile was also not up to the mark. So probably we took it with a pinch of salt. And now we dedicated look around for the heart. We identified a large sort of an subaortic VSD. So the subaortic VSD is very huge, and then we could identify that there is an intermingling of the blood both from the LV and the RV, and then we identify that there is an aortic override. So if you look closely, we would be in a position to identify that this is, yeah. So this is the point. So this is the point. Subaortic. So Down syndrome is one of the commonest aneuploidy that probably we are dealing up with. Whenever the age of the mother increases, the risk of the aneuploidy increases, definitely increases, and similarly, so is the incidence of the microdeletions also. So whenever we are identifying TOF, there is a conotruncal malformation, so that can also be there, right? But identifying a sort of an cardiac abnormality outright and large subaortic VSD and therefore the aortic override, it was not the variety for a blue variety of a tetralogy of LA, but probably we identified that large VSD was there, large VSD was a subaortic, and therefore an aortic override was there, and definitely so this hinted towards an aneuploidy. So Down syndrome is one of the foremost thing that probably we would have looked around for, and second would have been the microdeletions, right? So this is how, and the facial profile of the baby also, and then the small nasal bone for the gestational age, and then the age of the mother was also at 38 years. So clinical parameters as well as the fetal parameters, ultrasound indicators, they were indicating towards an the invasive testing, that is an amniocentesis, so as to look around what exactly that we're dealing with, and that is how it is, and therefore. So meaning thereby that what I want to highlight is this, that aneuploidies, if missed, they can really lead to this sort of an fetal hydrops, even though we identify whether done or whether it has been investigated on those lines. Hydrops happening antenatally at any period of time, Down syndrome has to be looked around for, right? Thank you very much for your patience.